Abortion saved lives. And I'm going to tell you the story of 4 different women who could have been saved by abortions and tell you some information after that. Nevaeh Crane was 18-year-old in Texas, and she did not support abortion at all. She found out she was pregnant, and she was excited and wanted the baby. Her and her mother were so excited. But when she was experiencing pain during the pregnancy and had gone to 3 different doctors, it took 20 hours before she could get an ultrasound, which proved the fetal death and allowed them to perform surgery. However, she died 3 hours later, anyways. Amber Thurman had taken abortion pills, and the fetal tissue was not ejected, so it stuck around. And when she went to the hospital, it took them 20 hours because of the abortion ban before they would actually look at her and give her care. She died a little while later. Candy Miller was in Georgia, and she had health complications that would make pregnancy deadly for her. So she used over the mail abortion pills, and it also had not ejected the fetal tissue. She was found dead in her home with her 3-year-old later on. Portia Numagezi in Texas had had a miscarriage and had gone to the hospital. Instead of looking into it or doing anything, they gave her misoprostol. She bled out later on. Her heart had stopped. Those are 4 different women that if they would have had the proper care they needed, the fetus was already dead. You wouldn't have been killing anything. But they died unnecessarily because of these abortion bans in both Texas and Georgia. Now for some health information and statistics. The University of Texas found pregnant teens were more likely to have high blood pressure and 5 times more likely to have something called eclampsia, which is a high blood pressure condition associated with seizures. They were also much likelier to have obesity, probably from the hormones of pregnancy. Their babies were more likely to be born before 37 weeks, which is premature. They were more likely to be underweight, and they were more likely to need extra neonatal care, NICU. And if you don't think teenage pregnancy is a big deal, I've got some statistics for you from the National Sexual Violence Resource Center. Their information from 2010 shows that 18.3% of women in the US, which is about 1/5, have been raped, whether penetrated, attempted penetration, or penetration with the help of drugs and or alcohol. They showed an estimated 13% of women experience sexual coercion, which is somebody trying to convince them to have sex and them accepting it but not truly consenting. 79.6% of women were found to have been completed raped. Completed just means that the individual was successful before the age of 25, and 42.2% before the age of 18. Now think about that. If 1 in 5 women were assaulted in the US, and of that 18.3%, about half of them, 42.2%, were under 18. That means that there's roughly a 1 in 12 chance that a little girl was assaulted sexually before they were 18. The 2015 statistics are not much better. Actually, they're worse. 21.3% of women in the US had reported being raped, whether forced, attempted, or with the use of drugs and alcohol. And 81.3% reported that it was before the age 25. And then I'm sure everyone is familiar with the Online Grape Academy uncovered by CNN, or at least talked about by CNN. It had 62 million hits in the month of February this year. And even if you say, well, some people are going there multiple times, well, even if every individual was using the website 100 times in the same month, which I would think is kind of improbable because that's 3 times a day, there would still be 620,000 individuals using that website, which is an army of sexual predators. So not only are pregnancies dangerous for women in the first place because of the strain it puts on their body, but also because of how damaging miscarriages can be, and if they're not surgically removed, it can kill the mother, but also they can get pregnant by predators attacking them. And if abortion bans don't include rape or underage or incest clauses, then that means that there are going to be underage girls in high risk pregnancies when they're not even out of high school. So anyone that decides to say that abortion, that their stance against abortion is to protect children, is absolutely full of it. My name is Dan Trujillo, and women, stay safe out there.